Hello, everyone. Thanks for taking the time to join us today. My name is Sharon Arabia, and I'm joined today by two of my Early Learning Program Regional Manager colleagues, Gina Lynn.
Hi, everyone.
And Asia Shepard.
Hello.
We're here today to provide a brief overview of the certification renewal inspection process. We've had the opportunity to present this to a work group of Conversations with Certification, and they have found it, the providers that participated in it found it to be very interesting and very helpful in maintaining compliance within their program. As we all know, we like to work together to maintain compliance within your programs. So I'd like to thank you for your commitment and supporting children and families, and look forward to working with you. So now let's talk about the certification renewal inspection process. Gina?
Hi, everyone. Before I start, I want to be clear that this is a guide and may not be exactly how your renewal inspection will be conducted. The flow of your inspection will in part be determined by how familiar you are with the certification rep and how familiar they are with your facility and with you. If they're walking into your facility for the first time, they may take more time during the entrance interview to explain how they conduct their inspections and to give you the opportunity to ask questions. They will introduce themselves and tell you why they are there. They will have ID on their person for your review. They will also need to see the ID of the facility director, or in the case of a group child care home, the primary staff person. At the time of the entrance interview, they may ask you questions if you transport, if you participate in swimming. They may review your capacity and the use of your indoor and outdoor space, and they may take the time to share any new information, as in bulletins or announcements put out by the department. The most important information you can take away from this is the questions will be asked. They may not all be asked at the entrance interview. They could be asked at the exit interview, during nap time, or during the record review. But all of the questions will be asked at some point throughout your inspection. Asia will discuss the physical site part of your inspection.
During your physical site inspection, your certification representative will have free and full access to your site throughout the visit. They will visit each one of your child care spaces that was measured and included in your capacity. As they go through each of your child care spaces, they are measuring compliance with the health and safety regulations. They may also visit your large muscle play space, your kitchens, your bathrooms, and any other space that the children have access to. During their physical site inspection, they are also doing supervision and ratio observations in each of the child care spaces. This may occur more than once during your inspection. For example, they may do supervision and ratio observations in the morning, at lunchtime, and or at nap time or the afternoon. They will also do a documentation review. They will review your staff files and your children's files. Your staff file review will consist of a minimum of 30% of your existing staff for child care centers and 100% of your staff for family and group homes. Also, any newly hired staff files, all of the newly hired staff files will be reviewed as well. For the children's file review, that is also done by random selection. They will review a minimum of 10% of the files reviewed, which is a minimum of 10 files or a minimum of 5 files or a maximum of 10 files. They may do this random selection by a variety of ways. They may ask you for your enrollment sheets and randomly select the children's names from the list. They may ask you where your children's files are stored and go to the file and pull their random selection that way. Or as they're doing their physical site review, they may, in each classroom, they may ask for children's names and just randomly select children to have their files reviewed. Also, during the documentation review, they will review other documents such as your insurance policy and any other logs like your fire drill log or medication log, and also your emergency plan and any other documentation that is required by the regulations.
Asia, may I ask a couple questions?
Sure.
When you talked about physical site, you said that that the certification rep will look at areas that the children have access to. What if I just tell the cert rep that children just don't go in there? They just don't go in that room. Will the certification rep still go in that room, or would they just take my word to say, oh, okay, children don't go in there, so I'm not going to go in there?
They may still need to go in the room to see what is in the room. They may also check to see if the children do not go in that room, if they are limited access to that room. So if there's a lock on the door or something to prevent the children from entering that room that the provider is saying that they don't have access to.
So if the children have access, the certification rep will have to look at that room.
Correct.
Great, thanks. My other question has to do with staff file review. You said in a child care center, existing staff, you only review 30% of the files, but in a family or a group home, you said they review 100% of the staff files. Can you explain the difference there?
Well, in your child care centers, there's typically, in your family child care homes or your group homes, there's typically 1 or 2, maybe 3 staff that they have the files to review. So since there's a fewer number of files to review, they're reviewing all of those files. But they're specifically focusing on items that change annually. So that's your health assessment forms or any other trainings that will have to be done annually.
Great, thank you.
Now, Sharon, can you tell us a little bit about the exit interview?
Sure. So now we've conducted the entrance interview. We've done the renewal inspection, the physical site, and the review of the staff records and children's records. So this is the time where the certification rep will either talk to the owner, operator, or the director of the program and talk about what was found to be compliant and what was found to be non-compliant. As Gina mentioned earlier, there may be some documents that are reviewed or some files that are asked about, such as, do you take children swimming? Do you transport children? If you administer medication, what is your policy, et cetera. So that may be done at the entrance interview or the exit interview, as Gina had mentioned. During this exit interview, this is where your cert rep will explain again what was found to be non-compliant. This is also the opportunity for you to have a conversation with your certification representative. Don't be afraid to ask questions about what was found to be non-compliant. If a certification representative says, I wasn't able to find a clearance in a staff file, and you know for certain that it was there, by all means ask them about that. Ask the cert rep about that. Look in the staff file because it may have been overlooked or it may not be there. But again, the reason I'm saying this is because you need to have that conversation about what the cert rep is finding. Nothing that we do is a secret. During this inspection and during this exit interview, I almost said entrance interview again. During the exit interview, you will hear about what the timeline is for correcting your outstanding areas of noncompliance. Your certification representative will give you contact information should you have any further questions after they leave, because sometimes that's when you come up with those questions, is when we walk out the door. Now, we talked about the inspection summary and we talked about areas of noncompliance. So that's where on that inspection summary you will find the areas of noncompliance. It is the expectation that you provide a plan to correct that noncompliance, and then the plan must include how to keep that area corrected in the future. Part of your plan of correction is also a date by which you will correct it by. Until all areas of noncompliance have been verified corrected, you must post that inspection summary in a conspicuous location within your program. All results of your inspections are posted on Compass for public view. Now, the certification rep can get your plan of correction at the end of the inspection if they have time or if their schedule permits. However, they may need to email it to you. And if that be the case, then you will receive it within 15 business days. You need to give us a plan of correction that includes the date by which it will be corrected by, and we must receive that within 15 calendar days. So, for example, and this is very far-fetched, but for ratio, if we find ratio to be non-compliant, and you say you will correct that within 30 days, that is not an acceptable time frame to correct ratio. We would need that to be corrected much more sooner. So if that was your plan of correction, that you will correct ratio within 30 days, that would be an unacceptable plan, and then you would need to submit an acceptable plan of correction again. You will be given that opportunity to give us another plan. And again, please have conversations with your certification rep about what an acceptable plan is. You know, they have a great deal of experience, and they've seen a lot in programs, so they could provide you with a lot of technical assistance around how to maintain that compliance, how to achieve and maintain that compliance. Now, once you've given us the plan of correction, the certification rep must come out and verify that you have corrected those areas of noncompliance. Once your certification rep has done that, then they will make the recommendation for your certificate of compliance. And for that, I will ask Gina to talk about.
Okay.
Before we move on,
Sure.
can I ask you, if a violation is corrected on site, will that violation still show up on the inspection summary when the provider receives it?
Yes, it will. Everything that is observed to be non-compliant during the inspection will show up on an inspection summary. The operator will be asked to give us a plan of correction, and then it will be notated corrected as of the date of that inspection.
Thank you.
You're welcome.
Thanks, Sharon. And just to clarify, the provider may not have the actual inspection summary on the date of their inspection, but they should be aware of the noncompliance that was observed by the certification rep.
That is correct.
Okay. Thank you.
Sure.
Okay, so your inspection is complete. Acceptable plans of corrections have been submitted, and noncompliance items have been verified as corrected, as Sharon just stated. The certification rep will then process your certificate of compliance in what is called a transmittal review item, or a TRP. The rep creates a letter to be emailed, preferably, to you, and will accompany your inspection summary and the certificate of compliance. The transmittal review item, or the TRP, is then forwarded to the supervisor of the certification rep. The supervisor then reviews the TRP for accuracy and will review any other inspection summaries to ensure they are all finalized. The supervisor then approves the TRP and generates the correspondence. The clerical staff email the certificate of compliance along with the letter and inspection summary to the legal entity of the facility. At that time, the renewal of the certificate of compliance is posted on Compass for public viewing. You may see your certification rep for other inspections as well. Other inspections could include your initial inspection, allocated unannounced monitoring visits, complaints, negative sanction monitoring, or other visits such as technical assistance, a request, facility issue, or a capacity increase.
Gina, are the complaint investigations, are they announced or unannounced?
Complaint investigations are unannounced visits. At that time, the certification rep will introduce themselves and tell you the reason why they are there. But they may need to, depending on the allegations, they may need to start their investigation process at that time and may not have time to sit down with you until after their investigation is conducted.
Thank you.
If you have any questions, please call your certification representative. The contact information is provided here for all of the regional offices. This information is also available on our website. Certification staff are available Monday through Friday, 8:30 to 5 p.m. to assist you. Thank you for joining us today. We should all work as a team to ensure the health and safety of children. We are here to help you become successful and maintain compliance with the regulations.